Now, a study released recently says in the next decade, breast cancer cases could double in Africa if action is not taken. Researchers at the University of Edinburgh in Scotland examined a total of 41 previous studies across 22 African countries. They found that rates of breast cancer are likely to increase in the region amid population growth, unhealthy lifestyles, poor health infrastructure, and lack of education for women. The team suggests that the trend could be halted if data collection and patient registration were improved. Cancer is a leading cause of illness and death among women around the world, and young African women are twice as likely to die from breast cancer than those in high-income countries, according to the study. Now, for more on the impact of cancer in general, I'm joined by Bigz Aloysious Bigirwa, co-founder and managing director of Educate Me Incorporated and co-founder of African Walk for Cancer. After losing his wife to breast cancer, Bigirwa co-founded African Walk for Cancer to raise awareness and mobilize resources needed to improve the lives of cancer patients. Bigz, welcome to Africa 54.
Thank you so much.
So it's really a tragedy. You lost your wife, and that really caught your attention to getting involved in cancer. Tell us more about that.
Yes, so thank you so much again. I was blessed to be living in the United States when my wife of then 1 year was diagnosed with cancer. Actually, it was sarcoma cancer, but it was around the lungs and the breasts. Okay. That's where it was mostly based. Mm-hmm. So I had first-hand experience seeing her being diagnosed and going through chemo and chemotherapy, radiotherapy. She went through surgery, and then she also went through clinical trials. Mm. So we did all the options available to cancer patients. Yes. However, because she was diagnosed at stage 4, it was stage 4 cancer, yes, chances were very minimal, if any. Okay. So we did our best. We were able to see the top doctors. And of course, the services here where we live around Washington, D.C., they're so good. So we got the best services. And it was able to, because of the good services, at least she was able to live for the next 18 months. Okay. To see our daughter of 4 months at the time grow into a young, interesting girl.
And as an African, you learned some lessons in that process, looking back at what is happening on the continent. You mentioned that you were blessed to be here and to have access to good medical care. But what were some of the lessons that you learned in the process?
In the process, I learned that if somebody has good treatment, it gives them a chance at defeating a disease, more so cancer. Mm-hmm. So we thought at some point that she was going to bounce back. She had, her cancer was in remission for about 6 months, when actually we were able even to go camping, go places, yes, because yes, she had been given the best treatment. Yeah. However, mm-hmm, reflecting back on what's happening back home on the continent, whether Uganda, you can talk of Kenya, you can talk of
many countries.
Many countries,
just,
yeah.
East Africa, yeah.
Not East Africa, Chad, yeah. Where there's nothing at all. Yeah. If it was in such a place, yeah, she would have died right away.
Right away.
Yeah. So I've learned that patients, more so cancer patients, need the best treatment.
And today you are an advocate. What is your focus?
My focus is not only about breast cancer, it's generally all cancers. Yes. And I'm not naive about other non-communicable diseases, yes, like diabetes, hypertension. But I would, from my research and from studies that are easily available, I've found that one of the biggest challenges, like right now on the continent, is cancer. And not everybody is lucky to be in the political or in the economic elites, mm-hmm, to be able to get on a plane and go to India.
For example, yes.
Yeah, for example.
There are many places that
there are places, yeah. There are places, so most of our folks who have money, who have political connections, are able to go abroad. But majority of our people, including my mother,
it's not accessible to many people. So we're running out of time, but you have a walk coming up. Can you quickly tell us about that?
Yes, so because of this experience, I decided I have to do something about cancer. And it's because of all the factors we've talked about. So I have a walk from, it starts in Washington, D.C.
September 8th.
September 8th at 10 a.m. Begins at around Washington, D.C., through Baltimore, through Philadelphia, up to New York City. We're supposed to be finishing around September 28th.
And what do you hope to accomplish?
To raise resources, to raise equipment, to raise awareness, most importantly, because I believe that when somebody says has a voice and puts up across a word, there might be somebody, maybe it might be a leader, a political leader, maybe those who have been blessed to be in political positions. Maybe it's those who have money. I understand that Africa has some folks, some people who have money, who have power, who can use those resources to help the continent. We don't have anybody to blame for our own problems, because when we die, it's us who die. So I believe that by having my voice out, I might inspire somebody to do something. But I personally, I believe I would do something with the resources that I will be able to raise.
Thank you so much, Bigz, and good luck on the walk.
Oh, thank you so much for having me here.
And that was Bigz Aloysious Bigirwa. He is co-founder of African Walk for Cancer.